All healthcare workers are first responders in a pandemic. As a worker in this industry, you have good reason to be concerned about the coronavirus COVID-19. The purpose of this video is to get you started with your own program of personal safety in your workplace. In this crisis, the community and the nation need you safe, healthy, and on the job. In a pandemic environment, each nursing care hour can seem like a new ambulance at the ER. For you to be safe personally, there are dangers that must be overcome by your employer. For the individual worker, it is only realistic to expect that supplies and expertise will run short during a pandemic. Remember, the more important health precautions for you must come mainly from you. Fortunately, the things to avoid with the coronavirus are the same precautions you have learned from the typical flu season. Hand washing is very important here as well. Hand washing and the avoidance of hot spots are still the key. The difference now is that you cannot safely ignore them. COVID-19 infects as high as 25% of healthcare workers in a contaminated facility. Your mission is to help avoid contamination and when it does occur, to help with containment. To contribute to prevention and containment, you first need to avoid getting infected with any virus and avoid becoming a patient yourself. It is quite clear that your health and safety become the keystone in breaking the outbreak. But do you have a plan to protect yourself? There are important steps you can take now, and it will take time. The sneaky thing about this virus is that it seems to stay one step ahead of our expectations. Touchpoint Focus is an employee self-managed, self-defense, disease prevention strategy for the workplace. It works like this. Touchpoint Focus means that you plan, right now, for your work routine. Look at the many locations, work activities, bathroom stops, and breaks. A daily routine means there is repeated exposure to germs at certain points in your shift. Because you run into these germ touchpoints frequently, they amount to the greatest threat to your health. When these vulnerable points are gradually neutralized by your process, you have gone a long way to reducing your own exposure to health threats at work. You are thinking of points in your work routine where the risk of infection is obvious to you. Make a list. This is where you must focus. This is your repair and maintenance list. You may need help as you work on your project. The range of possible repairs to your list has no limit. You may use simple avoidance, using stairs rather than elevators, or extra precautions such as gloves, masks, and easily cleaned clothing. You and a coworker may help each other stay safe. First on your list should be your entry into the facility, the front door. Is the front door a public touch point? Is the time clock or touch sensor a problem of exposure? Bathrooms can be a gymnastic challenge for touchpoint focus. Bathroom keys can be intimidating. Does anyone have a solution for this special puzzle? Doorknobs can make you sick, but there is usually an easy workaround. Most modern restrooms have fewer touch points. Some bathrooms are more challenging than others and may require avoidance. Returning to our touchpoint map, we have meetings, gatherings, and huddles. Face-to-face meetings have a downside. Perhaps you can listen through the door? Computer screens usually look pretty clean. If they are shared devices, then they look a little less friendly. Touch screens and computer mice are definite touch points. Eating areas are complicated. It's a close gathering for a much-needed break, but the real tab for the pizza may not come for 2 weeks. Who is most likely to sneeze? Working directly with patients is the most difficult touch point. There are times when this might need to be avoided. But, we cannot close the door on our patients. It will take coworker and supervisor cooperation to tackle direct contact with patients if meaningful precautions are to be made. It has been a hard day of serving your patients while protecting yourself. Don't lose your touchpoint focus yet. Getting out the door without focus can send home infection. Now is the time to start using your facility, your coworkers, and your personal resources to support your touchpoint focus. Begin using your program immediately and get good at it while you can. Grow your skills now, before it is clear to you that you should have started earlier. As new information comes out, look for new tools that could make your routine less awkward, demanding, and less tiresome. In other words, build your touchpoint focus. Then, learn to ease yourself through your new routine skillfully, like an athlete. You will initially find coworkers who will dismiss your efforts as alarmist or as setting up a too fearful attitude with the patients you serve. However, your touchpoint focus will also draw others to be more thoughtful by your professional example. As always, your medical patients will appreciate your efforts at securing their care. Remember that the greater the number of your coworkers who practice touchpoint focus, the less will be the cost of a single contamination error in what has by then become a safer general environment. Collective focus can make the job of staying healthy easier for everyone.